Federal judge in Texas ruled that some Affordable Care Act mandates cannot be enforced nationwide. Based on the ruling, insurers no longer have to provide some preventative care services for free. That means some customers could be charged for cancer, heart, and STD screenings, as well as smoking cessation programs. The U.S. Preventative Service Task Force had recommended that these treatments be covered by Obamacare. Insurance companies will likely continue its no-cost coverage for the remainder of their contracts. And an estimated 1.5 million people suffer a traumatic brain injury every year in the U.S., according to the CDC. And new research is shedding light on the long-term effects of this injury and changing how some believe it should be treated. Researchers at the Ohio State University Wexner Medical Center found that some traumatic brain injuries become chronic conditions requiring lifelong treatment.
We actually see people changing long after their original injury. And actually, the thing you're least likely to do is stay the same. If we were to proactively manage traumatic brain injury, like we do diabetes, for instance, to optimize someone's health and functioning lifelong.
The researchers say some continue to have problems with thinking, problem solving, or regulating behavior and are often unsupported after initial treatment, which can make those issues even worse. Those involved in the study are working to come up with new ways to help places like healthcare facilities, treatment centers, shelters, and even prisons, plus screen those with traumatic brain injuries and give them the care that's needed. And a division of Johnson & Johnson has stopped developing its vaccine for RSV. J&J's pharmaceutical division announced it is scraping its vaccine for the common respiratory infection. The vaccination for respiratory syncytial virus was ready to move to the late stages of clinical trials. The medicine was being tested to see if it could prevent the potentially serious RSV disease in adults over the age of 60. The company says it stopped the trial to refocus its portfolio and after an assessment of the RSV vaccine landscape. And emergency room visits due to firearms dropped last year, but the numbers are still higher than before the pandemic. A new study published today by the CDC found the weekly number of ER visits related to firearm injuries began to rise in March of 2020, about the start time of the pandemic, and they began sharply increasing in May of 2020 and remained high until last year. 2020 and 2021 were 37% and 36% higher than the rate of visits in 2019. The sharpest increase in visits happened in late May of 2020, the same week that George Floyd was killed.